Health officials say Yellowstone County is fortunate to have these many organizations open and able to meet the growing mental health needs. But if a new state mental health facility, like this one in Warm Springs, were to be built in Billings or Yellowstone County, it could tip a delicate balance over the edge.
But currently we are at that precipice of being able to keep the lights on at our own facilities and staff our own programs.
So a coalition of mental health providers produced this gap assessment outlining what it would take for Billings to be ready.
We have several gaps that are going to keep this facility from being successful and sustainable.
Some of those gaps identified include not enough doctors, nurses, and staff, lack of step-down support transitioning out of prison, and continuity of care for medical needs, among others.
And that was the point of the analysis, to come together with a unified voice.
Why do I want it here? I have the women's prison. I have 90% of the sober living homes. I have all the probation and parole programs here. I mean, what am I, the dumping ground for the state?
But the state is doing its homework. A new recruiting campaign is already bringing in nurses, and after some early fallout, they're making it a priority to meet with stakeholders before a new facility is decided on, according to DPHHS Director Charlie Brereton.
We understand, right, the interest, especially in Billings and Laurel and Yellowstone County at large. We will be there if that is ultimately the preferred location for the facility, to meet with local officials, city council members, county commissioners, mayors.
To create a two-way conversation, to change the public narrative around this, to reframe the conversation into saying, this is a need. We understand the need exists. How can we address it in the best way possible?
An address that county officials are still waiting to hear.
There still has been no discussion between ourselves and state DPHHS.
In Billings, Russ Riesinger, MTN News.